Good, happy Thursday morning, November 18, 2021. I'm Riley King. Welcome to this Thursday morning edition of the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Thursday morning, so let's get started right now. First up, COVID-19 infections in New Hampshire children at highest level of pandemic. Let's take a listen to that video from WMUR News 9.
Now's the time to get a great deal on taking care of your property. You need the #1 rated reliability of Kubota compact.
The numbers that we're seeing and the levels of COVID-19 in our community are concerning.
The state health officials telling schools and child care partners they are seeing evidence of schools contributing to transmission in the community. So far this fall at K through 12 schools, there have been 262 clusters with 2,644 infections, 88% of those in students.
Infections across all age groups have increased, certainly in the last weeks and months, but the increases have been most pronounced, particularly in our children.
State epidemiologist Dr. Benjamin Chan saying infections in those 19 years of age and younger are at their highest point of the pandemic, and schools need to act.
Implementing mitigation measures in school and child care programs continues to be necessary to prevent facility transmission, to prevent clusters and outbreaks, limit the size of the clusters and outbreaks.
Tonight, we asked Governor Chris Sununu if he would consider any new restrictions for schools. He responded, since the beginning of the pandemic, the state has empowered local school districts to make decisions that work best for their community. Blanket mandates across all state schools does not follow science or data, as each community is different. A small school in the North Country operates much differently than a school in Nashua, and each must have the flexibility to manage their own operations. Winter sports were also called into question during the call. Despite being high risk, health officials don't think it's necessary to cancel all activities, but do say schools should think about layered prevention strategies, including asymptomatic screening testing. Reporting live, Jason King, WMUR.
Okay, and there you go on that video and that report. New Hampshire health officials warn about increase in COVID-19 cases and hospitalizations. Let's take a listen to that video from WMUR News 9.
New Hampshire, the time has come. Boxing is back on November 19th. 4 World Championship fights at Manchester's SNHU Arena. Headlined by New England's Boo Boo Andre versus Ireland's Jason Quigley. Tickets start from $30. On sale now at Ticketmaster.com.
It is a very challenging time.
From the seacoast to the capital and points north, New Hampshire hospitals are trying to stay ahead of what state health officials are calling the beginning of another COVID-19 winter surge, which has the potential to strain an already stressed healthcare system.
We are, in addition to seeing the behavioral health patients, we're absolutely having an issue with the fact that we cannot discharge those patients who are ready to go to skilled nursing or long-term care, in part because those organizations are already facing stress on their own.
Hospitalizations are rising in New Hampshire just as they did last fall, but now they're happening sooner and there are more of them. Most are unvaccinated.
And it's going to go up dramatically. And if we don't do something different, our ability to care for everyone, for every patient that needs that care is going to be put at risk. And, we want to do everything we can to prevent that.
The key to control is through vaccinations, says state epidemiologist Dr. Benjamin Chan.
Certainly over the coming weeks and months, we could see further increases in COVID-19 in our community, further hospitalizations, more deaths, and that's concerning.
And with the holidays fast approaching, what should you do? Should you gather or should you not? Well, Dr. Chan says if you are fully vaccinated and you are gathering with others who are also fully vaccinated, you're good to go there. But if you are someone who is not vaccinated, he says he first recommends that you get a shot. But if you can't, he says limit the number of people at your gathering, test beforehand, and if you feel sick, just stay home. Reporting live tonight, I'm Tim Callery, WMUR News.
Okay, and there you go on that video and that report. COVID-19 hospitalizations rise above 300 in New Hampshire. Let's take a listen to that video from WMUR News 9.
It's the official tractor of Tough Cab Month at Mahindra. Get great deals on all cab tractors.
Tonight, New Hampshire is nearing a record number of active COVID infections as the positivity rate increases once again. Good evening, everyone. I'm Tom Griffith.
And I'm Jennifer Vaughn. The 7-day positivity rate is now at 9.3%. Current cases are also going up to 6,910. This is the most we have seen since the record of 6,994 set last December.
And there are just under 1,100 new cases to report, with 170 of those from prior days. And current hospitalizations up to 317, the most since January the 3rd. That's also getting close to the record of 335 on January the 1st. And 9 more people have died, bringing total deaths to nearly 1,650.
Okay, and there you go on that video and that report. New Hampshire hospitals and officials call for help. Patient as COVID-19 cases spike. Let's take a listen to that video from WMUR News 9.
It's the official tractor of Tough Cab Month at Mahindra. Get great deals on all cab tractors, including 0% interest on select models, or save thousands. From the comfort of a climate-controlled Mahindra cab, nothing will hold you back from working the land you love. Not extreme cold.
Wentworth Douglas Hospital is maxed out, but anyone walking into most any emergency department in the state will likely see the crisis underway.
Our ED is holding patients in the hallway. There's a very long wait to be seen. Obviously, we triage patients in the most serious, get in and get treatment immediately. But we are 130% over capacity everywhere.
From Dover to Concord, COVID hospitalizations are rising as they did last fall. But now there are more of them, and most are unvaccinated.
We recognize that there have been delays in care. There have been canceled surgical and procedural cases, and there have been pretty healthy wait times in the emergency department.
Exeter Hospital going from 5 to 35 COVID hospitalizations in a week, challenging a health system already stretched thin.
We are, in addition to seeing the behavioral health patients, we're absolutely having an issue with the fact that we cannot discharge those patients who are ready to go to skilled nursing or long-term care, in part because those organizations are already facing stress on their own.
And the number of COVID hospitalizations is expected to rise over the next several weeks.
And it's going to go up dramatically. And if we don't do something different, our ability to care for everyone, for every patient that needs that care, is going to be put at risk. And, we want to do everything we can to prevent that.
They say the one thing that the public can do to try to turn this around is to make sure that the unvaccinated get vaccinated, and for all of us to practice mitigation measures as we head into the holidays. They also ask for patience with staff because they are stretched thin, working long hours, and are doing the best they can. We're live in Dover. Jennifer Crompton, WMUR News 9.
So scrolling on your screen right now are some of the things that doctors say should not require an ER visit. They say going to urgent care or calling your doctor's office is a better option, especially with hospitals under such strain right now. But they do advise going to the emergency room if you have chest pains, trouble breathing, or bleeding or vomiting that won't stop.
Okay, there you go on that video and that report. Calls for reform in New Hampshire courts after a woman shot by man she accused of domestic violence. Let's take a listen to that video from WMUR News 9.
Now's the time to get a great deal on taking care of your property. You need the #1 rated reliability.
This was the scene outside a Salem, Massachusetts sailmaking business Monday night. News 9 does not identify victims of domestic violence, but the victim's mother says her daughter, who was shot in the head, is touch and go and having multiple surgeries. She also says petitions for protection orders need to be taken more seriously by the court. In New Hampshire, 8,000 domestic violence petitions are filed each year, according to the DOJ. Only 38% are granted.
We are seeing an increasing number of petitions that involve extreme violence that are being denied, and that is deeply concerning to us.
According to the petition filed in September, the victim rented a room in Massachusetts as part of her plan to escape abuse. But Richard Lorman, who police say is the one who eventually shot her, found out and was enraged. Advocates are calling for reform.
In this case, the victim alleged multiple felonies, and we are stunned and distressed that a court would deny a petition that involved so many serious crimes.
The Coalition Against Domestic and Sexual Violence has a message for New Hampshire courts in the wake of this tragedy.
We are calling on the New Hampshire courts to take this case very seriously and to do two things. First, to increase training for judges so that they better understand both risk and trauma. And second of all, to do a comprehensive assessment of protective order petitions so that victims who are in potentially lethal situations are not denied the relief that they need and deserve.
Polly Hall was appointed to the Circuit Court of New Hampshire in 2017, nominated by Governor Sununu and unanimously approved by the Executive Council. Governor Sununu released a statement this afternoon that says, "What happened to the victim is an absolute tragedy, and my thoughts and prayers are with her and her family. As soon as this was brought to our attention, I immediately contacted the judicial branch and confirmed this matter is being reviewed to the fullest extent possible." Live in studio this evening, Amy Cavino, WMUR News.
Okay, there you go on that video and that report. Officials say action needed as overdoses spike in New Hampshire across the country. Let's take a listen to that video from WMUR News 9.
For over 85 years and 4 generations, award-winning Palmer Gas and Oil has been serving communities throughout.
That's right, Tom. The White House has released a proposal to expand access to the overdose reversal drug, naloxone. Now, the law improves the drug's availability in rural areas, promotes education, and requires health insurance coverage for naloxone. According to American Medical Response, New Hampshire's seen a 22% increase in fatal opioid overdoses. The state's 2 largest cities have surpassed the total number of overdoses compared to last year already. In Manchester, there were 44 overdoses this October. Compare that to 32 in 2020. In Nashua, the 28 overdoses in October, doubling the total of last year.
We're losing an American every 5 minutes around the clock. We cannot afford to wait. We must act, and we must act with a sense of urgency.
We have to do prevention so that people don't enter the pipeline to begin with. We have to do housing for people so that they're in a safe location. They're not going to be in an area where they're using drugs or with other folks who are using drugs. And then we have to give them an opportunity once they're in recovery to get a job.
And officials say they're already bracing for another spike in November. In 9 days, AMR responded to 21 overdoses in Manchester alone. Reporting live in studio, Mike Cherry, WMUR News 9.
Okay, there you go on that video and that report. And that does it for this morning edition of the Riley King Newscast right here on the Riley King Network. I hope you all have a great rest of your day, and I'll see you back here later on today for another newscast. Goodbye, everyone. Thank you for tuning in and watching.